Researchers led by Shukrat Metalipov at the Oregon National Primate Research Center cloned embryonic stem cells using skin cells from this adult monkey. They went on to show that the stem cells could turn into any type of body cell, including these beating heart cells. Metalipov says the success shows the technique could be used to create human embryonic stem cells that match a patient's own tissues.
It probably will be much sooner than we anticipate. The science and technology develops so fast. So hopefully it's not going to be 20 years. Hopefully within 5-10 years we'll have first the therapeutic application of these cells.
The researchers extracted the nucleus of a skin cell and inserted it into an unfertilized egg cell to create a very early embryo, then collected its stem cells. Writing in the journal Nature, they report the efficiency is still too low to be practical for people.
We need at least 100-150 eggs to make one embryonic stem cell line. So at this efficiency, of course, it's not cost effective as a medical treatment.
Metalipov says the next step is to try to cure a disease like diabetes using the cells.
If we prove that these embryonic stem cells have great potential in curing many diseases, and I think the society will accept this as a medical treatment.
And he hopes studying how egg cells are able to reprogram adult cells will one day allow scientists to create therapeutic cells in the lab with no need for eggs or embryos. I'm Brad Closa.
When Lieutenant Ronnie Smallwood isn't working, he's fishing. And when he's not fishing, he's thinking about fishing.
Just being outdoors, just getting away, the relaxing time that you have.
Lieutenant Smallwood's been part of the Public Safety Department for 27 years, and those years have taken a toll on his heart.
The work day, all I wanted to do was go to the house and lay on the couch till bedtime.
He suffered from congestive heart failure. Heart bypass failed twice. One of his last options, to heal himself with his own stem cells.
The idea behind stem cell therapy is that by giving cells into certain places where the muscle may lack blood flow, we can stimulate the growing of new blood vessels.
Dr. Emerson Perrin took Ronnie's own bone marrow, filtered out stem cells, and then, with a catheter, precisely placed Ronnie's stem cells in the part of the heart that needed them the most, with no risk of rejection.
What we're doing with the stem cells is hopefully creating better blood flow to areas of the heart that don't get good blood flow.
They're giving me a natural bypass, just naturally growing arteries. How it's done it, I don't know.
Lieutenant Smallwood is now getting blood flow to the lower part of his heart.
I started noticing the pain wasn't near as bad. I've got energy again.
And now that he's feeling better, Ronnie's ready to give up his desk job and spend his days at the lake.
In tonight's Health Alert, nearly 70% of adults ages 35 to 54 have lost at least one permanent tooth. And by age 74, more than a quarter of American adults have lost all of their permanent teeth. While there are options to replace those teeth, what if you could actually grow your own? Dentures are in the past, dental implants are the present, and this could be the future. Teeth grown from stem cells.
People really care about their teeth, and they really care once those teeth are gone.
Danka Premovic agrees. When previous dental work failed, she began wearing a mask.
I'm a perky person, I'm a people person, and for me to cover my mouth and wear the mask, it's just not me.
Today, she has 8 implants. It's patients like her, dental regeneration researcher Peter Murray wants to help.
It would be nice to give people back their own teeth and make their whole body whole again.
To grow teeth, researchers isolate stem cells from the mouth or bone marrow. The cells are multiplied in the lab, then grown on 3D scaffolds. These are stem cells attached to an actual tooth.
All the animal studies that have been done so far are very encouraging, so it looks like the clinical trials will be successful.
The teeth can be grown in the lab and implanted in the patient, or they could actually grow inside the patient's mouth, filling in empty spaces with new teeth in just a few months.
This will be, in the future, the standard of care for dentistry is to use stem cell therapy to regrow teeth or parts of teeth.
Dentist Sharon Siegel says there's no doubt about it.
If they can have a part of their body replaced by a part of them, I think we're going to have a whole new era in dentistry.
Though Danka is happy with her new implants, she says she'll be first in line when clinical trials for these begin. And Dr. Murray says growing replacement teeth from stem cells will pave the way for growing other complete replacement body parts. He says the teeth are relatively safe because if a tooth fails, it can simply be extracted.
If you watch this rat with spinal cord injuries closely, the transformation is amazing. After receiving an injection of an embryonic stem cell therapy from Geron in Menlo Park, the animal is able to regain movement. Now the FDA has authorized Geron to test the same type of therapy in people with spinal cord injuries, the first research of its kind in the world.
When we run the course of trials, hopefully we'll have a cell therapy that may restore function, organ function, or even just sensory perception and motor control below the site of the injury.
Embryonic stem cells are blank cells found in embryos which have the ability to turn into any cell in the body. Geron will begin using its therapy on people in clinical trials nationwide later this year. The company plans to start with about 10 patients. Those patients must be completely paralyzed and receive the therapy within 7 to 14 days after injury. At this spinal cord injury support group in San Jose, the news of the breakthrough was a hot topic.
We don't want to jump the gun and give people false hope, but at the same time, I think it's exciting.
And while Janie Whiteford may not benefit now, she says the research is finally moving in the right direction.
You know, I think it's absolutely possible. Whether it happens in my lifetime or not, I'm certainly not holding my breath.
In San Jose, Marianne Favreau, NBC Bay Area News.
Researchers in the UK say they've been able to create human sperm from embryonic stem cells. It's hoped that the research could help reveal causes of male infertility because scientists can study exactly how sperm forms. This may also allow them to study how genetic diseases are passed on or how cells involved in reproduction are affected by toxins. For example, how young boys who must undergo chemotherapy can become infertile. The sperm created from this experiment are not identical to normal sperm and are not mature enough to fertilize an egg. Researchers say the sperm cannot and will not be used for fertility treatments, shutting down any talk of creating humans in a lab dish.
At age 14, Matthew Barmore is already 6'1" with a passion for basketball. But just a few months ago, Matthew's doctor saw a problem, a nearly 50-degree curvature in his spine. Diagnosis, scoliosis.
Before surgery, the lump on his back caused by his spine, the curvature of his spine, was about the span of both my hands together.
If the curve progresses, it can have profound effects on their heart and lung functions.
Surgery to correct scoliosis used to mean cutting a large piece of bone from the iliac crest in the pelvis, then using it to create a spinal fusion, so the curve didn't get worse.
The problem with taking the bone from the iliac crest is that it's a significant source of pain, sometimes even permanent pain. It requires another incision, a potential risk for infection, and that bone is gone forever.
But Matthew was able to take advantage of a brand new therapy recently cleared by the FDA to repair his spine using stem cells harvested from his own bone marrow.
That's your concentrated stem cells.
Used with bone from the bone bank, Matthew's stem cells would act as a sort of catalyst to support the growth of new bone along the spine and work with permanent screws and rods to fuse it into the correct position.
Any pain when I push on this?
The surgery reduced Matthew's curvature from nearly 50 degrees to just 15 degrees.
Okay, bend forward. Boy, that's much better than before surgery, Mom. Do you see that?
Oh, yeah.
And just 3 months after surgery, Matthew's already playing one-on-one with twin brother Jordan, getting stronger every day.
I'm able to shoot, dribble, run, jump. If this is an indication of what's going to happen, I think it will just get better.
And now, Matthew's dreaming of a very big future.
What else? The NBA.
This is Jennifer Matthews reporting.
We find between a 50 and 75% reduction in the amount of scar in the heart after the heart attack. That we have no other therapy that we know of that can reduce scar to that extent. Hey, how's it going? Good.
Good. Everything's good.
Yeah. Yeah, it looks beautiful.